Many companies make them stool tests. So they show a very good picture of what's happening inside our gut. Yes, for chronic unresolved digestive issues which are not going away after you're taking care of your diet and not eating chemical synthetic foods, eating natural and careful about toxins, but still you see the problems are carrying on, lingering on. There are very good tests. Many companies make them stool tests. So they show a very good picture of what's happening inside our gut. But there are many tests which will be quantitative. They will count that in a gram of stool, how many billion or million the important strains are present. These tests will point out the diversity. They will separately point out the pathogenic strains. They will show us the virus is present or not present. And one can come to know about the bacteria separately, the fungals separately it will show up. Parasites will be shown up separately. And people all must have heard about H. pylori because that's also a part of our stomach. Bacteria lives there, but in controlled numbers. And if acid levels drop, they love to thrive with less acid. Or when they're thriving, they'll push the acid levels down more. So these tests will also pick up if H. pylori is present or not above the threshold numbers. And some tests will even show us if there are virulence factors of the H. pylori. So this will help your practitioner a lot to know what really is going on. So often, if a practitioner feels this test expensive, but if he feels it's going to give a very clear picture, if the situation is very chronic for a very long time, the person is trying everything, then these tests do give a very clear picture to the practitioner as well to the patient client, because they see and they can show it to the family, because it's very important.